So I'm going to talk about conjunctivitis this time. Conjunctivitis, but before that you need to know what conjunctiva is. It is that covering, it's that outer covering of the eye. It's the connective tissue that covers the eye. And what conjunctivitis means, the itis that comes after the word is always indicative of some kind of inflammation. So what that means at this particular time is there's inflammation of the connective tissue that is over the eyes. This can be due to viral causes or bacterial causes. If it is viral causes, then you can always, generally, if there's any kind of viral causes, you can suspect a prior infection. And if it's bacterial, it could be even because there's a lot of normal flora in the skin that can cause an infection. So we'll anyways look at that. So if it's viral, the common causes would be something like adenovirus or enteroviruses. If it is bacterial, we would want to be looking at some skin organisms like I said, Streptococcus, pyogenes, Staphylococcus aureus. So these are the organisms you want to keep in mind. But also, bacterial type can become really severe. And if it does, the organisms you want to think of is gram-negative organisms. So what I said before were gram-positive organisms. Alright, so bacterial, viral. Bacterial can become more severe. Viral is not that severe. Bacterial organisms, Staphylococcus, Streptococcus, Neisseria, viral, adeno or enterovirus. So after having said this too, we had to look at the clinical features because I have already mentioned the algorithm. So if you look at the clinical features, the presentation, we need to be able to differentiate both these, two ends. Otherwise, it's meaningless, isn't it? So always remember bacterial, it will always tend to be purulent, meaning there'll be whitish discharge. So bacteria will have whitish discharge, but no associated lymphadenopathy. There will not be any kind of enlarged lymph nodes. But that doesn't mean it won't have. Most of the time it will not have. In severe instances, it's possible. That's what needs to be kept in mind. And in viral causes, you usually will not have any kind of purulent discharge. It will be just clear, but there will be an associated lymphadenopathy, and the lymph node usually involved are the ones at the back of the ear. And these things are usually referred to as preauricular lymph nodes. So we have looked at the clinical features, we looked at them both at the same time, so it's much easier to remember. Right. So clinical features, investigation, if it's viral, we don't usually do a lot of investigations. But on the other hand, if you're looking at bacterial, you can take take the discharge, you can culture that. And then you can possibly find an organism. If it is really urgent, then you want to start antibiotics before. You take the sample and then you start the antibiotics before you can get the culture. So the culture of an organism is going to take some time. So sometimes in the time between, the disease can get worse, and at that time you don't want to be not doing anything, right? So for that, you'll be prescribing antibiotics just as soon as you take the sample. Prescribing it before taking a sample is no use because the antibiotics already would have an effect on the organism. So antibiotics according to the organisms. In viral, you don't actually do anything like that. Just some supportive measurements and assuring the patient that everything is okay. That is basic. That's as simple as this can be put down. When I had been mentioning, I had forgot to mention about the other possible eye features because I was differentiating both of them. I had not mentioned them. So just to summarize that quickly, generally you want to be on the lookout for what I had already mentioned, the discharge as well as the lymphadenopathy. But beyond that, because it's related to the eye, because something is of the overcovering of the eye, you can think of photophobia, irritability, worsening vision, or some halo-like features. Now that this has been said, now when photophobia comes to your mind, you have to always think whether this could be meningitis. So that the idea of excluding it should be popping into mind. right? So eyes are affected, eye features, know how to differentiate it from the bacteria, keep and be alert for meningitis features.